Today we have the opportunity to talk to Susan Frampton, the President of Planetree in the US, a group that has led many innovations in the area of patient-centred care. And we get the opportunity to talk to Susan and ask her about her experiences and her career and challenges to date.
I've actually been involved in healthcare for my entire career. I was a graduate student in medical anthropology, and one of my field placements was to work with a sickle cell service, and this was a pediatric genetic service at a local hospital in Connecticut in the US. And I worked with a lot of the families in the inner city that had children that were very ill. And I ended up being kind of a liaison between the families and the healthcare professionals, because when the children would go into crisis and they'd be taken to the emergency room, this was a time when there was still a lot of sense on the part of the healthcare system that people were trying to just use the system to get drugs. It was really a terrible situation in many ways, and that people didn't know how to navigate the system to get their children the care that they needed. And so as a graduate student, my heart really went out to them. I thought, this is just not, it's not fair, it's not right. There seemed to be a whole disenfranchised group of people trying to do the best that they could in navigating a very complicated system. And so I think that really changed my view of the world and made me realize there's such a need to advocate for the rights of patients and their families. And we're always going to have this very sophisticated, very high-tech system that human beings are trying to negotiate without really having the skills and training to do that. I think that's really what first made me so interested in the patient-centered side of things. And so I worked in a whole series of hospitals over the first 20 years or so of my career, and then the last 10 or so years I've been with Planetree, and it's been a wonderful opportunity to help shape healthcare to be more human-centered or patient-centered, and to do it in a much more global context, not one hospital at a time, but really looking at our systems and how can we influence our systems. Planetree is a not-for-profit that was started in 1978 by a patient who had a less than optimal experience in a hospital in the United States. And she came away from that experience feeling that there needed to be really a revolution in healthcare, that we needed to transform care to be more responsive to the human needs of patients. She felt that she got very good clinical care, but from that human side of things, what the delivery of that care felt like to her was very cold, very institutional, very unresponsive. A lot of the things that we hear about today in terms of the patient-centered side of things. So my role as the leader of Planetree is really to help to define what excellence in patient-centered care is, but to do that through dialogue with patients, not to take my opinions as a healthcare professional and make the decisions around that, but to really stay in touch with patients' families, and with the frontline caregivers, and to ask them to define what's an optimal healing experience, what is patient-centered care to them, and then to take that information and to use that to try to shape and change the culture of our healthcare systems. There are several things that really excite me about what's going on now in terms of patient-centered care. One of those is just the fact that it's finally being talked about. Everywhere you turn now in healthcare, people are talking about patient-centeredness. What is it? How do we measure it? What does it look like? So just the fact that it's finally come into its own after several decades. I think the other thing that's really exciting is the extent to which patients and patient advocacy groups are beginning to have a place at the table, that it's not just the healthcare professionals that are defining it, but it's the patients themselves who are saying, wait a minute, we have some of the answers here and we want to partner with you. We don't want the same paternalistic approach anymore to the way care is delivered. We want to help to shape what that looks like. And to me, that's exactly where we need to be. When I think about where we may be 10 years from now, or where I'd like to see us at, I see a future where patients truly are partners in their own care, where they and their families are welcome to be a part of the healthcare team, that there's not an us and a them, there's just an us, and that we all work together in partnership. And that, I know, is going to take a great deal of shift in culture and the way that our systems are organized now. But I think that we're moving in the right direction, and I hope that that's where we get to, where consumers or patients are really motivated to be active and to be engaged in their care, not to be passive recipients, but to really have a place at the table, to be involved in decision making, to make sure that they have the information that they need to make well-informed decisions. That's my hope, that we really are able to achieve what I think right now we're putting the things in place that need to be in place to get us there.
Thank you for joining us again today for a spotlight on another leader in the field of patient-centred care. It's always amazing to learn about people's personal experiences and the things that drive them, and we've certainly seen that passion from Susan Frampton today. Hopefully you'll be able to join us again for another spotlight in the future.